I'm here to talk to you about drug and alcohol use and abuse in the workplace because we have had a program in place in our sawmill since 2011. And recently we have made it a requirement for our contractors to also have a program in place. So I want to give you some background of where we started. First of all, we had a lot of evidence of use and abuse in our sawmills and in our woodlands operations. We saw paraphernalia, we saw roach clips, we saw pipes, we saw excessive alcohol use in our camps. Some of them were logging camps and some of them were tree planting camps. And we suspected that drug and alcohol use were causal factors in some very significant and serious injuries and fatalities. And in fact, we have evidence that supports this. It's made us wonder whether or not a testing program could have prevented these serious injuries and fatalities. The other thing that happened is we recognized that our supervisors were not able to deal with the situation. Drug and alcohol use is a very delicate subject. People don't know how to approach it. It affects people personally. So this is something that we definitely have been working on with training our employees recently. The one thing that our old policies, before we implemented this program, were very brief. And I could say that most of our contractors' policies were the same. They basically said we have a zero tolerance to drug and alcohol use in the workplace. We got 10 points on the council's audit, and we're good. But what we realized is that we were unable to enforce this rule, and the policy just had no teeth. We couldn't do anything about it because it's just, without a testing program to prove and show evidence, you just couldn't do anything about it to enforce it. So again, a little bit of background. Interfor embarked on this huge safety program. We had a lot of really serious injuries, recordable injuries, and we looked at all of them, both in the sawmill environment and in the wood side, and we determined that if our employees and our contractors followed these 5 rules, if they followed, I don't have a pointer here, do I? Anyways, if they follow these 5 rules, they would stay safe. This would have prevented 80% of our injuries. Now notice the first one, we are always fit and capable for work. So what does that mean, and how in the world do you enforce it? So you're probably thinking, okay, it means being physically capable for doing the physical demands of your work. It also means being rested. It also means being in the frame of mind to do the job and to have mind on task. It also means to show up sober and not under the influence of drugs and alcohol, not in the workplace. Okay, so I notice some of you are contractors who work for Interfor, and I know that you know that we do in fact work really hard to enforce these rules. But it's very difficult for us, and me in particular, it's very difficult for me to have a conversation about the quality of somebody's PPE, the brightness of their VisiVest, whether or not they've cleared a logging truck on a bush road, the mechanical soundness of their machinery. How can we have that conversation and ignore the big one that's staring us right in the face, which is are our employees and workers fit and capable of doing the job we've asked of them? We have, Interfor has approached this by rolling out drug and alcohol testing for our contractors, our woodlands contractors. We base this on the history and the successes that we've had in our sawmills. So since 2011, we onboarded 1 sawmill, and then we onboarded more sawmills as we learned We incorporated a small trucking group in 2013. They were also part of the program. And now we have incorporated the rest of our logging, our harvesting and woodlands contractors. Between 2016 and 2017, they'll have a program in place. This is based on the knowledge that 12% of our post incidents are positive. Just think about that number for a second, 12%. Person has an incident, and a safety incident, it triggers a drug and alcohol test, and 12% of them are positive. For us, this is a hard number to swallow, and by and large, the population that created that sample included a small group of truckers, and it included sawmill workers. So most of these people are union workers, medical benefits, consistent work shifts. They show up at the same steel box 5 days a week, and they're testing positive at 12%. What do you think our woodlands groups are? The guys who are on shift work. They're on early shift 1 week, they're on a night shift the next. They're working in this drainage 1 week, this drainage the next. Their travel schedules, seasonal work. It made us question, what in the world would they be at? What are our truckers at? Well, actually, the truckers here, that small group, they're testing 18% positive. Okay. What are our tree planters at? Why are we not having this conversation about drug and alcohol use in the workplace? Why has it taken this far, this long for us to start talking about it? It's astounding, really, and it's the next step. This is the one safety program that many licensees, many big companies have not. They just haven't even gone there because they don't know what to do. They don't know how to even start. Well, we started with a testing program. It's a comprehensive program. It's not super fun, it's not super easy to implement, but that's at first. In time, it just goes. I see my old buddy Scott Wynn, he knows at first, the first test you do it's hard. You're like, do I have to do a test or not? And you have to kind of go through the process. And after a while, it's just like doing another incident report. It's just part of the program. What's Interfor testing positive for? This is it. So, surprised me a little bit. I thought we'd have more alcohol in there, seeing that it's legal. 76%, about 75% marijuana, 10% alcohol, 11% cocaine, and we've had a couple of test refusals, which we consider to be presumptive positive. We don't know what they're on, but they refuse to test. So does this surprise you? With the legalization of marijuana coming up, what do you think you guys are going to be facing in your workplace? When you go into a liquor store and are able to buy your bottle of Merlot, and right next to it is a bag of marijuana, we're going to have a lot more people experimenting. And we're going to have a lot more people showing up to work under the influence of both of drugs, probably more so than alcohol. So for us, this is a marijuana problem. But really, even with the legalization of marijuana, it doesn't mean alcohol is legal. It doesn't mean that it's still acceptable to be under the influence of marijuana in a work site, right? It doesn't make any sense. You can't accept alcohol on a work site. You can't accept marijuana on a work site. We Canadians have a soft spot for marijuana. The goal is to improve health and safety. This is a health and safety program. It's not a program to weed out people. It's a program to rehabilitate, not terminate. Although termination can happen for severe breaches in policy. We can't ignore the problem. All this is really is taking risk out of the business, isn't it? We never, ever, Interfor never, ever wants to wonder whether or not a test could have prevented a serious injury. We've had situations, we've had incidents where before the testing, we wondered very much so. I wonder if this, are we really investigating this? Did this truck really roll over because of the road conditions? Or did it happen because he was under the influence of drugs and alcohol at the time of the incident? Now we're able to tell, and basically it's an investigative tool to put us in the right direction. Stimulants, cocaine, depressants, marijuana. We had a guy last week had pupil size less than 2 millimeters. They're like pins. It's crazy. Without a policy, people will make different decisions. With a policy, people change their behavior. That's my experience. Okay, so we do pre-hire testing. We call it pre-hire. Sometimes we call it safety sensitive testing. We also do reasonable cause testing. So reasonable cause testing is when you see indicators of impairment. A person smells like marijuana. A person has got a staggered gait and can't really stand up on their own 2 feet. That's reasonable. We call that reasonable cause test. We have a reasonable reason to believe that somebody's under the influence of drugs and alcohol in the workplace, and we can test that person possibly. Post-incident is the majority of our tests. 95% of our tests, 97% of our tests are post-incident. And of those, 12% of them are positive. So what happens is a person has an incident. It's a significant incident. Usually is somebody was hurt, they have a recordable injury, so needs off-site medical attention. It could be a damage incident. Maybe for our contractors, we have it set at $5,000 or more. It's a triggering incident. Do we test just because it's a triggering incident? No, we go through and look at the accident emissions. That employee had to do something wrong, basically. Had to fail to follow a safe work procedure, make a decision to cut the corner in order to do a test. And what we've learned is that a testing program is a huge deterrent. People do not want to bring attention to themselves, and they will follow the safe work procedures to avoid having to do a test. You see what I mean? We also do return to duty and follow-up testing. So that's after you have a positive test, you send them to a substance abuse professional, and they will put them, likely, if they're a recreational user, on a return to work program, which is like 6 unannounced tests in 6 months or something like that. Just something that is part of a comprehensive program. Interfor uses urine, split sample urine and breathalyzers for our testing. Huge investigative tool, huge deterrent. Early intervention for those who need help. That's all that the program's about. We have seen a material difference in our safety program because of it. It's a ton of work to implement this for all of our contractors, our logging contractors and woodlands contractors. It's not an easy task, it's big. And we're not doing it for fun. We're doing it because we have evidence that it makes a material difference in the health and safety of our programs. Individuals make different decisions. They may quit drinking early on a Sunday because they know they have to go to work on Monday. They just take their jobs that much more seriously. And a lot of people get comfort knowing that there's a less chance they're working with people who are impaired too. So it's a prevention thing for only for, for individuals, but for the collective. Okay, so with that, that's all I have. I'll close. I'm here for lunch if there's any questions.